veteran and struggling, but you're just not comfortable seeing a VA therapist, you are not alone. Maybe the last therapist crossed boundaries, or you just didn't click, or maybe they just didn't get you, whatever your reasons are. You may not feel safe opening up in that system anymore, you may just not want to. Whatever the reason, you still deserve help. So let's talk about your options, including ones that the VA will pay for, and then some that are completely free resources that are outside of the VA. Option 1 is community care outside of the VA, and this can be covered if you get the referral through the VA. The VA can actually pay for you to see a non-VA provider. It's called community care, but you'll need to go through the system to request it. Here's what you can do. You can ask your VA provider or primary care team for a referral for community care mental health. You can explain why VA therapy isn't working for you, and you don't need to give graphic details. Just say it's a matter of safety or comfort. If they deny it, you can appeal, and you have the right to request care that works for you. Here's a quick tip. You can cite the VA Mission Act 2018, which has expanded access to community providers if the VA care doesn't meet your needs. Option 2 is vet centers. These are free and confidential. Vet centers are not technically part of the VA health system. That means no notes go in your VA medical record. No diagnoses are required to get help, and there are no copays. You can walk into a vet center and talk to another veteran, a licensed counselor, or even attend a group therapy service. Services can cover combat trauma, MST, grief, and more. You can find a location of a vet center at www.vetcenter.va.gov. Option 3 is Vets for Warriors, which is a peer support line. Sometimes you just need somebody to listen and not diagnose you, not treat you, just listen and understand and hear you out. And that's what Vets for Warriors does. They're 24/7, and every single person answering the line is a veteran or a military family member. And you can call 1-855-838-8255, or you can visit www.vetsforwarriors.com. Option 4 is online and app-based counseling, covered or can be free. If sitting in an office isn't your thing, you can use telehealth therapy. Some platforms are now approved through the VA, like Telemental Health through the VA, Talkspace, veteran-specific plans, check for VA compatibility, Headstrong, which is free therapy for vets with no hoops to jump through, and just an added bonus, Headstrong works fast and offers trauma-informed care. And you can learn more about them at getheadstrong.org. And then option number 5 is also free groups and peer programs. You'd be surprised how many free veteran-specific groups there are out there. Some options include the Wounded Warrior Project Odyssey, the Mission Continues, which is a service-driven recovery program, Warrior Surf Foundation, Boulder Crest Foundation, or Veteran Yoga Project if you're open to alternative healing methods. These aren't therapy, but they're therapeutic, and they can connect you with community. And to find more information out about these programs, you can go to bouldercrest.org or missioncontinues.org. You deserve options. You don't have to suffer in silence. You don't have to stick with a therapist who makes you feel worse or makes you feel uncomfortable, or a therapist who you feel you don't click with. The VA doesn't always make it easy, but there are ways to get you help on your terms. If one door closes, smash a damn window open. Not literally, please. You served and sacrificed. Now it's your turn to heal, and you should be able to heal on your own terms. Hi, my name is Jamie. I am a former addiction counselor turned writer, and now I have found myself being more passionate about veteran advocacy when it comes to mental health care, just due to an experience that my husband had in the VA program. Not all VA programs are bad. Some can be very, very helpful, and they do have some really great services, but I also know that this can depend on where you live. And I want to try to bring you more information about ways that you can get help on mental health, or if you have a crisis, here on TikTok. If you found this video helpful, please smash that like button, that save button, or repost.